Welcome to adaptnclex, and thank you for joining the channel. Today we'll be doing a couple of questions. If you see a bunch of questions loaded on the website, it's because I did a lot of questions with you. So this is a question, like as usual, I always like to do a set of question because I feel like that's the way to go to make you guys comfortable. If you subscribe to this channel, you should be very, very comfortable with sata because that's all I talk about. So this is a select or apply, a lot of questions. You just have to break it down as we do our ask case, buzzwords, rewrite, and make a choice and then move on without comparing. So what do we have? It says select or that apply. Then they asked which additional assessment. So we're looking for something assessment, finding the next should anticipate. So that's our ask right here. Then we look for the case. You have a client with history of depression on sertraline, so some antidepressant, developed intractable nausea due to chemotherapy. So she has nausea because of the chemotherapy. She was placed on dacitrone. So and this is a follow-up on the short video I made on dacitrone. So we're just following up, keeping up with the same tune. I think there's a lot of question idea over there. So she presented to the emergency room with a temperature of 104. Which additional assessment the nurse should anticipate? So our ask is assessment, the case, you got to break it down. So many words, 5 lines. The patient who has depression was on sertraline, also getting chemotherapy and developed intractable nausea, and they prescribed ondansetron. Then she presented to the emergency room with the temperature of what? 104. That is high temperature. Something is wrong. Okay, 104 temperature. So then you tell yourself, you got to break your buzzwords. Your buzzwords are what? Ondansetron, I would take ondansetron as one of them. Sertraline, temperature 104. That's all. And you need assessment. So assessment relating to ondansetron, sertraline, and temperature of 104. Just by looking at it, you have to bring your content. The temperature is too high. There's something going on. Sertraline is a serotonin receptor reuptake inhibitor. That means improve the level of increases serotonin in the synaptic cleft, and so that the individual serotonin will go up, and that will help with their depression. Guess what? Ondansetron, what it does is it block. So if this is the cell, and then it block the cell from taking serotonin. So there's more serotonin up in the system. So you have increase in serotonin. So we have one medication that is increasing the level of serotonin, the other one to also preventing it from getting taken up. So in total, both of them is increasing your serotonin. So this is a serotonin syndrome problem. And you know what a serotonin syndrome is. Everything goes up. Everything. So you're taking this information, look at the answer choice, and make your decision without not comparing one. So diaphoresis, where a patient is sweating, classic, they will be sweating. Hypertension, so the blood pressure goes up or down. Autonomic instability is the same thing. Reflexes is iPad. Like I said, everything is going down. So this is a follow-up on something we've done already. Diarrhea, how does it sound? Down or up? It's up. That means you're having a lot of fluid. Mydriasis is also the same thing. Everything is going up. So here and here. And calm, patient is very calm. Is opposite to what you expected. So for this is, no, they are very, very agitated. And so we have 1, 2, 3, 4, 5 as our answer. And as you can see, this is the way you go. This is how you answer select or apply questions without any problem in the flawless manner. Okay. So let's move on. The same question, the same idea, the same topic. I feel like there's a couple of questions in diet medication, so I'm making it up, but it's very good at questions that they can ask you. A client was prescribed what? The same medication. The client was prescribed ondansetron for intractable nausea. Which of the following require immediate what? Action. The same thing, SATA question. You know how to do it. SATA, which of the following require immediate action? There is a priority function associated with this, and a client would prescribe what? Ondansetron. So what is it about ondansetron I have to worry about? That's all. That's the rewrite. That's the broken down statement. Something about ondansetron I need to worry about when I'm looking at the patient. And so that's all. You make it easy for yourself. I'm looking for something that I have to worry about it that is related to ondansetron. So you come, you said, okay, Motrin for knee pain. Okay, that's fine. There's nothing wrong with it, right? Amiodarone for AFib. What do you think? Amiodarone for AFib. What the question is asking is they don't tell you. I intentionally put it in that way. So you're looking for side effect of ondansetron. So if you hear it, there's two side effects: the extrapyramidal side effect and the QT prolongation. These are the two. So that's how you answer pharmacology question. Anything about immediate action, what is the bad stuff about that medication? Extrapyramidal side effect and the QT prolongation. So that's what you're looking. And if anything meets the criteria here, you pick it. So amiodarone for AFib, amiodarone for long QT, to slow you down. And therefore, you cannot combine amiodarone with ondansetron. That's not good. Therefore, this needs intervention. Erythromycin for UTI. Erythromycin, the macrolide. All the macrolide, they don't react well with ondansetron. Therefore, this one, we got to intervene. Immediate action. Serum magnesium of what? 2. That is not bad. The whole idea is anything that will potentiate the effect of the ondansetron to cause what? Prolonged QT is your answer. To make it prolong, right? Erythromycin also make it prolong. Serum magnesium of 2 it doesn't prolong QT. It's normal, so that's good. If it's to be low, yeah, it prolong QT. Serum potassium of 3. One of the signs of changes in the EKG due to potassium is prolonged QT. So you have to know there is a depression of the ST level, and there's also presence of the prolongation of QT. So you have to know that information. And the T wave can get flattened. So you have flattened T wave. You have depression of the ST segment. And then you have prolonged QT. So those are the things you worry about. Prolonged QT, potassium can do that in low levels. So that's another. So 2, 3, and 5. And that's how you answer such a question. Bringing your knowledge and looking for that, especially if it's a pharmacology one. You have to figure out to pick up the keyword in the question, and then you can figure out all of the rest. Okay, and this is the end of it. Take care of yourself, keep charging, and practice more questions. Okay, bye-bye.